Do you know your blood pressure? I wonder if you are aware that one of the biggest threats to your heart and brain could be developing right now without causing any symptoms. I still remember my first blood pressure practical session in medical school. Our professor taught us something I have never forgotten. The diagnosis of high blood pressure should not be based on a single blood pressure reading. This is because blood pressure changes continuously. Anxiety, physical activity, pain, caffeine, even the experience of visiting a clinic can affect it, and that lesson is even more relevant today. Around 30% of adults in the UK have hypertension, and millions are living with it without knowing. That's why hypertension is often called the silent killer. But let's find out what happened to cause high blood pressure. Imagine your blood vessels when you were young. They were healthy, soft, flexible arteries that expand with every heartbeat. Over time, those blood vessels can become thicker, stiffer, and less responsive. The heart now must work harder to push blood through rigid arteries, raising the blood pressure. A healthy blood pressure is generally considered optimal if below 120/80. Persistent blood pressure of 140/90 or above require further assessment for hypertension. Please be aware that high blood pressure usually doesn't give symptoms. Sometimes it's discovered during a routine health check or before an operation. In a minority of people, there is a specific underlying cause, such as kidney disease, hormonal disorders, obstructive sleep apnea, or certain medicines and illicit drugs. But for most people, hypertension develops through a combination of age, genetics, poor metabolic health, and lifestyle. Insulin resistance can be part of the metabolic dysfunction. Persistently high blood pressure can gradually damage the heart, brain, kidneys, eyes, and blood vessels. What can we do about it? First, know your numbers. Get your blood pressure checked, and if it's high, don't rely on a single blood pressure reading. Your doctor may recommend monitoring your blood pressure at home or a 24-hour blood pressure monitor to confirm or refute the diagnosis. Second, remember that medication is important when indicated, but lifestyle is also powerful. One of the best studied approaches is the DASH diet. Dietary approaches to stop hypertension, built around vegetable, fruits, whole foods, appropriate protein, and reducing excess sodium. And that's where I want you to begin. Your blood pressure is more than two numbers on a machine. It's a message from your cardiovascular system and metabolic health. So today I have one question for you. Do you know your blood pressure? If you do, put your latest reading in the comments, or simply write, "I know my numbers." And if you don't, perhaps this is your reminder to get it checked. In my recently published book, Your Metabolic Shift, I explained practical lifestyle changes that can lower your blood pressure, starting with what you put on your plate. You will learn why fruits and vegetables rich in potassium are helpful, processed foods high in salt are harmful, and regular exercise and weight loss can help control your blood pressure, and why pet owners tend to have lower blood pressure. Start today by knowing your numbers, understand your metabolism, and act before the silent killer gets a voice. Thank you.